shook the minister's hand this morning when that announcement was made, because it is a step forward for Cape Breton University, a step in the right direction. And Mr. Speaker, we here that come to Halifax from Cape Breton are saying, we can go home and say to people that finally, Cape Breton University is coming of age. It's rightfully, the name is rightfully displayed as Cape Breton University, not a college or anything else, but Cape Breton University, equal to the other great universities in this province. And that's all we had asked for. That's all we had asked for. And today, the step in the right direction has begun with the designation of 40 Bachelor of Education seats at Cape Breton University. And I'll conclude, Mr. Speaker, by saying this, that the staff, the President Harker, and his staff have told me that this is a wonderful day for that institution in Cape Breton. And I'm sure that every single parent in Cape Breton who has an opportunity to send a son or a daughter to Cape Breton University for a Bachelor of Education, and at the same time saving thousands of dollars in costs that they would otherwise accrue by traveling off the island or to the United States, will no longer be the case. And again, Mr. Speaker, it's a good day for Cape Breton University, and today I stand with my colleagues from Cape Breton, all of them, and say that it is a great day. It's a great day for Cape Breton University, and it's a great day for Cape Breton. Thank you, Mr. Speaker.
Thank you very much. The Chair now recognizes the Honourable the Minister for Health Promotion and Protection.
Thank you, Mr. Speaker. I intend to split my time today between remarks concerning my department and programs within the Department of Health Promotion and Protection. As well, some of my time will be focused on my constituency, Mr. Speaker. In respect of the time of the House, I intend to speak for about 10 minutes, and I may not finish, but Mr. Speaker, I will come back at some future time and finish my prepared remarks. I want to, first of all, thank the member opposite for his passionate speech about Cape Breton University. I know that he's spoken in this House many times about Cape Breton University, and I can only imagine that at some point in time in the very near future, when we as members of the legislature attend high school graduations, we will begin to see teachers who will graduate from Cape Breton University on the stage, proudly wearing the colors of their university along with their robes that they wear at the graduation ceremonies. And I know that will be a proud moment for those teachers, and it will be a proud moment for the member opposite and others from Cape Breton Island who are so supportive of that great university in Cape Breton. Mr. Speaker, I want to thank you and the members for the opportunity to speak today, particularly about the Department of Health Promotion and Protection. I absolutely love being the Minister of Health Promotion and Protection, and not just because of the great work we're able to do, but Mr. Speaker, I have some incredible staff, great staff who absolutely love what they do for this province. And many of them, Mr. Speaker, are new to government. They're staff that have been hired. They may have worked through an advocacy group or for a variety of different agencies, but they all come to our department with the same focus and the same mission and the same goal, and that is to help make Nova Scotia the healthiest and safest province in the country. It makes my job easier, Mr. Speaker, and it's because of that staff that I'm motivated each and every day to work towards that goal. Now, we've done a great deal of work to improve the health and safety of Nova Scotians, and we are dedicated to continuing that good work into the future. Mr. Speaker, in 2002, we were the first jurisdiction in Canada to create an Office of Health Promotion. In 2006, under the leadership of our Premier, we expanded into a full department with the inclusion of health protection aspects, including public health, and the Office of the Chief Medical Officer of Health. Mr. Speaker, I am so proud to be the first Minister of the Department of Health Promotion and Protection, helping Nova Scotians to be healthier and safer. Mr. Speaker, thanks to the commitment of our staff, our partners, and our stakeholders, we have already had some tremendous successes. And Mr. Speaker, I am pleased today to share with the House some of those successes. Now, we use a number of population surveillance studies to help us measure the success we've had, as everything we do and implement is evidence-based as well as researched. There are a number of key studies that have helped us keep our eye on the puck, Mr. Speaker. The Nova Scotia Student Drug Use Survey, physical activity levels and dietary intake of children and youth in the province of Nova Scotia, the study we call the PACEY study, our gambling prevalence study, and our tobacco use monitoring survey. Mr. Speaker, I would like to start with reduced tobacco rates. Before I continue with my prepared remarks, I want to thank the member for Glace Bay, who, along with the mayor for Wolfville, helped bring forward a piece of legislation that will help protect children and young people in our province, Mr. Speaker. We were, again, leaders in the country. We've now seen where other jurisdictions have looked to Nova Scotia as being a leader, including, as I understand, the province of British Columbia just recently, I think yesterday, announced they intend to do the same thing that we've done by eliminating smoking in cars when children are present. I had a tremendous opportunity to share with the government of Scotland just 2 weeks ago. At their invitation, they held an international summit on health inequalities. They wanted to know about our successes. In Scotland, they were hearing about the good things we were doing in Nova Scotia, and they needed my advice and the advice of Nova Scotians to help them as they move forward with a similar type of legislative package. Mr. Speaker, in 2001, we adopted the country's first comprehensive tobacco control strategy. This strategy included legislation protection against exposure to secondhand tobacco smoke. It included smoking bans in workplaces, in bars, in restaurants, in patios, and now even vehicles where children are present. Community-based cessation and treatment programs, including access to free pharmacological aids such as nicotine replacement therapies. Mr. Speaker, this particular element of our tobacco strategy is absolutely critical. In addition to providing nicotine replacement therapy, we also provide counseling. We know from the research that we've done and the research of others that the combination of counseling and the pharmacological aids, people in Nova Scotia will be able to quit smoking, and our rates will even improve and our health will improve as a result of that. We've had legislation to prevent tobacco companies from advertising and promoting their product at point of sale, Mr. Speaker. That's legislation that's had a great deal of controversy, but supported by 100% of the members of this House, and I have to thank all members for their support of that piece of legislation. Mr. Speaker, I'm proud and pleased to report to members that our staff have been actively working with retailers with respect to that particular piece of legislation, and my understanding is from our staff that we have nearly complete compliance of all of our retailers, and we're going to make sure that Nova Scotians understand and comply with a very important piece of legislation. Mr. Speaker, as a result of this strategy, we have gone from the worst to first when it comes to tobacco reduction. In 2001, the overall smoking prevalence rate in Nova Scotia was 30%. When measured in 2007, the rate dropped to 22%. Mr. Speaker, it is with great pride that I can stand here before you in this House and report to my colleagues that Nova Scotia now has the lowest youth smoking rates in the country at only 12%, Mr. Speaker. Not so long ago, we led the country in that staggering statistic. Mr. Speaker, we have confirmed these reductions from a number of sources, including Health Canada, the Canadian Tobacco Use Monitoring Survey, and the Nova Scotia Drug Use Survey. Mr. Speaker, another area of focus is in physical activity among Nova Scotians. Mr. Speaker, the reality is that our children and our youth are not active as they should be. Based on parent self-reported data, less than 50% of Canadian children and youth are sufficiently physically active. When physical activity and obesity is objectively measured, 91% are not obtaining sufficient levels for health benefits, Mr. Speaker. We have been tracking this trend through the PACEY study. We are the only province in Canada to have established and conducted a population surveillance of objectively measured physical activity in children and youth, and we've done it twice. Mr. Speaker, this study measures specifically the percentage of children and youth that obtain 60 minutes or more of moderate or more intense physical activities on 5 or more days a week. We also measured the environment, psychological and physiological determinants of physical activity and food choice behaviors. We measured height, we measured weight, and we measured waist circumference. And we measured food intake. Mr. Speaker, the PACE study took approximately 2,300 students in grade 3, 7, and 11. The first study was done in 2001 and then another one in 2005. It measured again height, weight, waist circumference, and BMI. We used accelerators to objectively measure physical activity for 7 consecutive days. And we used questionnaires to measure social behavior and environmental factors. Mr. Speaker, 4 months ago, I was pleased to launch a renewed Active Kids, Healthy Kids strategy at Gottingen Street Community Centre in a fierce winter storm. The strategy aimed to increase physical activity levels by 10% by the year 2010. It's an ambitious goal, but it's one we must meet, Mr. Speaker. I have much more to talk about, Mr. Speaker. I do intend to rise on another day on debate going into reply to finish my remarks and to talk more about my constituency, but I'm pleased to take my seat, Mr. Speaker, as we move into supply at this point.
Thank you. Kerry. Order, please. The Committee on Supply will now be called to order. The Honourable the Deputy Government House Leader.
Thank you, Mr. Chair. Would you please call the estimates for the Department of Health?
The estimates for the Department of Health. I will now recognize the Honourable the Minister of Health to make some opening comments and maybe introduce his special guest.
Thank you very much, Mr. Chair. Very pleased to be here today to discuss the budget for the Department of Health for 2008-2009. I'm joined by, of course, most of you know, my Deputy Minister, Cheryl Dorian, and of course my Chief Financial Officer, Alan Horsberg, beard and all. Our vision for healthcare, and I thank them, of course, they're very, well, I had to shave it off after a while. I couldn't get new shoes. And I decided it was good to get rid of that beard and look a little cleaner, make myself look younger. Thank the member for Timberley Prospect for saying that I look younger without the beard. So again, very pleased to be here today to discuss the estimates for the Department of Health. Now, our vision for healthcare in Nova Scotia is simply generations of Nova Scotians living well, Mr. Chair. That is a goal that we share with our partners in the healthcare system, the district health authorities and the IWK, through whom we work to deliver health care, treatment, and services to the people of Nova Scotia. Our budget this year, as it has been in previous years, remains focused on ensuring appropriate, effective, and sustainable health care services to promote, maintain, and improve the health of Nova Scotians. Sustainability is not an easy objective to achieve. As costs increase, as populations increase, as they age, the demand for services continues to increase. Not only is that increasing, but of course, the treatments themselves and the demand for those new and innovative and a lot of times expensive treatments increases. Which is why the department, together with the district health authorities and the IWK, have embarked on a journey of healthcare system transformation. Now, just 3 months into this mandate, we have already been making solid progress in beginning this transformation. We've launched 3 project teams for the Model of Care Initiative, the Citizen Engagement Model, and the integration of continuing care. We've established the governance model for the initiative, and the project management office will soon be up and running, and a lead for the health system transformation will soon be in place. Mr. Chair, it's a difficult process. There's a lot of projects happening all at the same time, and it was one that I was unable, I'm sure my deputy minister was unable to manage off the corners of our desk because of the importance of system transformation in Nova Scotia. In keeping with the principles of this work, we have asked for no new money in our budget to develop and initiate these changes. Instead, over the course of this year, we do expect that the districts will realize some significant savings from some of our early work, which we will continue to reinvest to support transformation in the healthcare system in Nova Scotia. Now, the principles we have embraced in accepting all 103 recommendations of the Provincial Health Services Operational Review, I believe, is one of the reasons why we've been able to keep our budget increases down to a modest but effective amount this year. Health continues to be the largest percentage of program costs to government, this year at 43%. At the same time, total new initiatives for the department, that is new initiatives, not the expansion and continuation of programs, is only at 1.39%, or $41 million. Now, by far the largest new initiative that we have for this year is the new Nova Scotia Family Pharmacare program. Now, this year we receive $26.7 million to make the total budget for the program since its inception, since its start back in early March, $32 million. And with over 8,000 families already registered, that number growing every day, the program is already providing much needed pharmaceuticals and financial relief to those Nova Scotians who need it the most. And I do want to thank our Premier, for all my cabinet colleagues, for their dedication and their interest in making sure that no Nova Scotian will be left behind when it comes to pharmaceutical coverage under this Family Pharmacare program. And Mr. Chair, it's also to be said that this being a new program, we'll continue to monitor the progress of this program, the uptake of this program, the coverage of this program, to make adjustments as we go along to make sure that it is appropriate and effective for many Nova Scotians as we possibly can make it. Now, not so long ago, maybe a few hours ago, when we had the opportunity to be questioned, as we normally do during questioning period, I believe the member for Sackville-Cobequid talked about wait times, and I'm sure he'll be talking about wait times when his opportunity comes up to discuss these issues. Now, reducing waits and improving access to appropriate healthcare services is an important priority for this government, and be more important for Nova Scotians, which is why I'll be tackling this issue on a number of fronts. Mr. Chair, just by saying a wait time doesn't mean that you're going to be able to address it. There are many factors that come into consideration when looking at wait times and finding ways to better manage the list that we do have. We'll be increasing spending on our colorectal cancer screening program by $2.7 million to allow full implementation of population-based colorectal screening program this year. Every year, 750 Nova Scotians are diagnosed with this terrible disease. And through screening, We know that we can catch this disease early, resulting in better outcome for patients. We are very pleased, I'm very pleased, to increase mental health spending this year by $2.8 million. This investment will allow us to expand mental health and addiction services across the province with particular focus on children and youth, with particular and on addressing areas with the highest weights, particularly here in Capital as well as at the IWK. One that I think is going to make have a huge impact on our healthcare system is the investment of $3.96 million in a self-care telecare service. Patients will get to talk to a nurse who can provide much needed information to direct them to the appropriate place for service. In doing so, emergency room visits will be reduced. Be able to call an RN, be able to say, my son, my daughter, my mom, my husband, my wife has experienced this kind of symptom, to be able to get the best information that they possibly can have, and they can make their own decisions whether the visit to the ER, a call to 911 is warranted. And Mr. Chair, a lot of times there are some very commonsensical issues or things that can be done to maintain the health of our loved ones that do not require the visit to an emergency room. So, Mr. Speaker, or Mr. Chair, I do feel, again, this is a very important piece and will be a very well-used program in our healthcare system. It also gives us, I believe, an opportunity to offer employment to, I would say, what would qualify as either late career nurses or nurses who have issues with working 12-hour shifts and those kinds of things. Gives them an opportunity to use their very important skills and knowledge to help many more Nova Scotians. So I think it's a win-win for Nova Scotians, for nurses, as well as for we, the government of Nova Scotia. Now, we are well on the way of our goal to have a wait time guarantee of 8 weeks for patients needing radiation therapy with the help of Canada's $33 million at this time. 2 pilot projects are underway to improve access to diagnostic imaging and orthopedic services for patients. Additionally, another component of wait times when it comes to orthopedics, we'll be establishing a clinic where orthopedic patients can be assessed much faster and therefore receive faster treatment. A similar project, the Bone and Joint Canada, I believe it was what is called in Alberta, reduce wait times in that province from a number of months. And I forget the total length of wait times in that province. I do believe it's very similar to what ours was. It brought it down to weeks with this assessment clinic, where not only that every person waiting for a referral for a specialist to look at either knees or hips or whatever it may be in the orthopedic world, to get them the appropriate type of treatment. In a lot of cases, the individuals who are on our orthopedic wait lists need physiotherapy. And if they got physiotherapy now, they wouldn't need a hip later. They wouldn't need a knee later. They need maybe some certain pharmaceutical interventions, etc. By getting to see these individuals through a clinic, which will be staffed by nurses, other professionals, physiotherapists, with visiting orthopedic specialists, we believe we can really cut down our wait list when it comes to orthopedics by this initiative. So we're confident that Nova Scotians will see significantly shorter wait times as a result of this project, which fits well into realigning, as we have over the last number of months, $1 million in our current orthopedic budget, where 500 more patients will be treated through a demonstration project with Capital Health and Scotia Surgery. Mr. Chair, I know from sort of the exit surveys that we are doing, the Capital Health monitors patient satisfaction with the services that they are receiving from Scotia Surgery, that it is very, very good at this point. People are very happy with the service, being able to be seen for minor orthopedic surgeries, knee scopes and the like, at a faster rate. And Mr. Chair, I do have some numbers that maybe I'll share later on of the costs that we're seeing related to those minor surgeries as we go along. Another great piece that we've been been working with through Capital Health and through the Department of Surgery there. They've just completed a one-day pilot project using operating room facilities at CFB Halifax. The Stadacona Hospital has been a landmark just down on the north end off North Street for many, many years. And is basically a very underutilized hospital, one that has a number of operating suites, an endoscopy suite. I believe it does have a CAT scan, I think, in it. It does have a number of different diagnostic equipment that can be used to see patients. It is a hospital that is being used maybe a couple days a week. So why not use a facility like that in conjunction with, of course, D&D, Department of National Defense, in using that facility, because it uses the facility. We know that the equipment's working. The staff working at that hospital can also be helping out and working, keeping up their skills. So we think it's a very good fit to the overall surgical capacity for the province, and especially here in HRM. I do want to personally thank for this project, and for I believe we'll end up having a good agreement written up and signed off by both parties in the very near future. I want to thank Rear Admiral Dean McFadden for his dedication to this one. I know the Admiral will be moving on, I believe, on Friday to another posting, but I do know that he did want to see the completion of this project and the utilization of this project towards the patients here in Nova Scotia, and being able to use a hospital. I believe that is a very good asset to this community. I also want to thank Dr. Yap Bonnier, Chief of Dal Surgery, for his foresight in this one, to work with D&D in setting up this project and to see its continuation. I also want to thank Yap for his work in keeping the promise. Of course, there's a document brought out by Capital Health and Dal Surgery to utilize the existing infrastructure here in Halifax. What we found is there was a number of surgical suites which were not being used for a number of reasons, principally the lack of anesthesiologists. And knowing that we've recruited a full complement of anesthesiologists here in the HRM through Capital Health, through the hard work of Dr. Mike Murphy, we can now utilize all those suites. And I know that utilization is up, and I believe it's causing us a bit of a numbers crunch as well, to make sure that we have the dollars available to them to see the patients that are lined up to have their surgeries done here in Halifax. So I do want to thank Yap and his staff over at the QE2 through Capital Health for their dedication to see more patients and get them the surgeries that they need. Now, over the next 2 years, which another item you'll see in our budget, is an additional $10 million over 2 years be invested in our electronic health record system. Now, this $28 million project will create an electronic health record for all Nova Scotians to support decision-making and case management by health professionals. Mr. Chair, I was, a bit, I wouldn't call it upset, but it was, perplexed why. Thank you very much, Mr. Premier, for that. Perplexed how my records, my medical records, could not be seen by a doctor in Sydney if I would get ill in Sydney, or my medical records would not be able to be seen in Ontario or BC or wherever I may find myself in a bit of a problem medically. And God forbid, over the last number of weeks, I found myself in a couple of situations that have kept me in hospital and keep some issues there. So hopefully that can be rectified as well. But Mr. Chair, my information cannot travel with me. So we need to have an electronic medical record system that information can travel with us, so that doctors who are seeing us, specialists who are seeing us, can make the best decisions possible when it comes to our care if we make it to hospital. The best example, or the best story that goes along with this, would be comparing the health system as an airline, where you would get on an airplane with being the one physician or the one specialist getting on that airline, and flying somewheres, and you have to stop. Let's say you're heading for Toronto, and you have to stop in Montreal, but then you'd have to go and book your flight again. You'd have to get out, book your flight, fill all your information out again, and then get on the next airplane. Now, for some reason, the airline industry, whether rightly or wrongly, do track patients, track their passengers from one point to another, and most times get their baggage along with them as well. Our system, our health system, cannot transfer information in that way. So I think it's very important for us to invest dollars when it comes to EMR to make sure that our information, that when doctors look at our file, when they see us, that they can make the best decisions possible because of that information sitting before them. Now, Mr. Chair, I also want to say that over the next number of months, we've also taken the lead as lead province when it comes to Canada Health Infoway. And Canada Health Infoway is, of course, the federal organization that does fund dollars when it comes to electronic issues in the province. So, Mr. Chair, I think this is a good fit to make sure that we have the dollars available to put this EMR into place and have our information readily available to those practitioners when they see us for whatever ails us. And finally, to coordinate our many activities relating to wait times. Again, this is an issue of not being able to manage all these things off of the side of our desks. We've hired a chief executive, wait time improvements in the province. So it'll be the one person will be our go-to when it comes to wait time reduction in this province. This dedicated position will monitor progress, improve capacity and responsiveness, and of course the efficiency of the programs that we will be putting in place to make sure that patients in this province will be treated in a much more efficient manner. Another very important priority for me and our department is to enhance and expand continuing care services through our continuing care strategy. This year we'll spend $142 million on home care, and we will be spending $377 million on long-term care services across this province. Now, research and analysis that is now underway, which will inform us how to best provide an adult day programs to Nova Scotia. I believe that helping people stay in their communities longer, helping them stay at home longer, really is helped out by having some kind of respite option for the families who are taking care of them, as well as true recreational opportunities for the senior who might only have the opportunity to sit at home, watch a television. And that is not an appropriate, type of recreation if we were trying to keep our population healthy, and especially this population that does require a little extra in keeping them as healthy as we possibly can to keep them out of hospital and, of course, out of long-term care facilities. This year, we will open 400 new spaces, giving patients and their families that much needed support. So I look forward to really expanding that adult day service so that more seniors can be seen and treated and helped out in their daily activities. I'm also pleased to report that this year we'll be expanding our palliative care services. We've established the provincial palliative care coordinator position. We do have an acting person placed in there, I believe at Mrs. Scaravelli, which is very well received by the palliative care community to make sure that this program continues to expand over the next number of years. That position will help with the development and implementation of a province-wide standard and, of course, the policies that go with it on a true palliative care program in this province. Of course, through the continuing care strategy, government has committed to building 1,320 new long-term care beds. 840 of these beds will be open by March 31st, 2010. And Mr. Speaker, Mr. Chair, I do believe that everything is still well on track to have these beds in place when we ask them to be. And Mr. Chair, also I had the opportunity yesterday to visit Glasgow Hall. Glasgow Hall is one of our, and also the member for Dartmouth South, Portland Valley was there with me as well on the opening of this wonderful facility. This facility will be housing 72 seniors. They are large rooms with their own bathrooms and showers. They are also equipped to hold husbands and wives, so couples can actually go and stay together if they choose to within this facility. And I want to personally thank the Shanix group for their help in this one. The opportunity as they were building this retirement campus over in Dartmouth, the opportunity came to us that they could, with little effort, they could transfer what they were building to be a residential care facility into a long-term care facility to house these 72 individuals. And I got to say that they did it right. The opportunity to live within your own community of about 12 seniors on a floor, to get to dine together, get to do recreation together, get to live together, is absolutely phenomenal. The other option that I found very interesting is that next door, through the connection of a hallway, is the residential care or assisted living facility next door. And that assisted living facility next door can house, of course, couples, take away a lot of the responsibility of taking care of a home. And I thought it was very impressive because, you went into a dining area. I don't know if you saw the dining area where it's actually restaurant style. So the senior who's there can go sit down and order from a menu. So there's not just one choice or two choices, as a lot of our residential care facilities do offer. They can actually go sit down, have a meal of their own choice. There was a lounge downstairs, so they can actually have a bit of a pool game with their friends. There was a theater where they could sit down and watch movies with their friends, all within this large community. Heck, there was even a bowling alley. There was a bowling alley in the basement with 2 lanes. And what they were actually doing with it is that people that are in the long-term care facility, they were wheeling them down in their wheelchairs, and they actually had the opportunity to bowl in this bowling alley. And I got to say also, Mr. Chair, I was very proud of my capability. I hadn't actually really bowled in a while, but I know I've been practicing with my 9-year-old son on his Wii, and I was able to get a spare on the bowling alley. So I thought I did pretty darn good there. So, but I do know that having that type of recreation available to those seniors is extremely important for their well-being. The Minister of Health Promotion and Protection talked about healthy living, activity, and all those things that it's very important to keep people healthy and out of the hospital. I think is being replicated by the group over Portland Valley. Now, Mr. Chair, again, my personal thanks to Jason Shannon and of course his father Joe, and of course all the Shanix group for the phenomenal work that they did in setting up this and their dedication to take care of seniors in this province. So I do want to thank them for a wonderful facility over in Dartmouth. And I get a little off my speech here. I will succeed some time to the member from Lunenburg.
Thank you, and we'll recognize the member from Lunenburg for an introduction.
Thank you, Mr. Chairman. And Mr. Chairman, it's my honor to introduce to the host today a number of visitors that are in our gallery. They are a group of students from the Netherlands who are visiting Nova Scotia over a period of a number of weeks. They are staying in Lunenburg, Mr. Chairman, and in fact, one of the young men is staying at our house with my son Matthew and the rest of our family. The students are also accompanied by a number of students from Lunenburg Junior Senior High School and a teacher from Lunenburg High School, Don Ernst, who is also accompanying those students. So, Mr. Speaker, I would ask that those students and visitors and chaperones and Miss Ernst rise and receive the warm welcome of the host on their visit to Province House today.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. I do also welcome all these visitors to the House of Assembly. You know, yeah, the Minister of Immigration over here might be interested in talking to you if you do want to stay. It's a long story. Mr. Chair, just for that comment, I have to apologize to them. Our member opposite really knows not what he says. So.
Order. Let's get back to business. Order. Let's get back to business.
Thank you very much, Mr. Chair. Going back to long-term care and the importance of the continuing care strategy and all the things that are going on there. Of course, as we're opening up the 840 beds across the province, it also means that we're planning to ensure the right health human resources are in place to staff them. Last year, over 900 new continuing care assistants were enrolled in training, and this year we expect another 1,000 more individuals to be enrolled in our programs. And Mr. Chair, I can also say that I sign off on every one of those certificates for them, and I'm looking forward to signing off on another 1,000 of these certificates to allow them to practice their skills in long-term care facilities in this province. To ensure that we maintain this momentum, this year we hired an HHR continuing care project manager who is working closely with the continuing care sector in development of a new HHR strategy to increase organizational and human resource capacity for the continuing care sector. And beyond what we're doing in concert with NSCC, a number of our partners, whether it be the Shanix Group, the GEM Group, etc., are also doing some of their very own training to make sure that they have the professionals available to work in their facilities. So that's a tremendous amount of training that we do need to do. But Mr. Chair, I can assure everyone in this House and all Nova Scotians that we will be ready to open those beds and to staff those beds when that time comes. Now, retaining and recruiting the right human resource is a challenge that faces every province and every country. And Mr. Chair, the opposition continually asks us questions around retention and recruitment, and of course their personal experiences in their own communities, especially the rural ones, in the attraction and retention of those individuals. Now, in Canada, Nova Scotia is one of the most successful provinces, not only with more family doctors per capita than any other province, but also many other professionals. We have a lot of nurses. We have a lot of physiotherapists and occupational therapists and many of the other allied health professionals. But Mr. Chair, we know, this government knows that many more people are needed to staff the hospitals and long-term care facilities and health clinics in this province. Now, that's why this year we intend to spend another $11.4 million to either maintain or expand the baccalaureate nursing seats at St. FX University, Cape Breton University, and Dalhousie University, the Halifax and Yarmouth campuses. This investment will also support practical nursing seats at the Nova Scotia Community College. Now, continuing education is a key priority for our nurses. And I know the member for, I believe it was the member for Sackville Cobegood who brought this up during questioning period today when it came to nursing as well, that nurses are, of course, a priority for us. The continuing care, the continuing education for them is important to us, and they'll be able to provide patients with the highest quality of care. Now, under the nursing strategy, this year the province is launching an e-learning program for registered nurses and licensed practical nurses to give them easier access to continuing education opportunities, regardless of where they are located. You know, my experience with the nursing program, of course, is with the Yarmouth campus. We've always had a nursing program in Yarmouth, whether it was the older two-year program or whether it ended up being the four-year program through Dalhousie University. And you know, I never really thought so much about having that availability, having that kind of talent pool to draw from in some of the other areas. But Mr. Chair, I can assure that that through our telehealth system, that nurses in some of the other areas that don't have the opportunity to have a school nearby, that training can continue to happen on a regular basis, rather than them having to sort of pack up stakes and head to Halifax or head to Cape Breton University to get that further education, and therefore we lose them for a certain period of time. so they cannot offer the services that we so well need. When this program is fully implemented, nurses will have access to extensive educational materials on about 50 topics, and over time, the number of materials, of course, is expected to grow. And all of these topics will be destined for the specialty that nurses would like to go into, and of course, that'd be more appropriate that we feel for us, whether it be OR nurses, whether it be, I believe, and a whole bunch of other programs that nurses could be available to. Now, we'll soon be finalizing a new contract. I think something that we talked about a little bit today, of course, during my scrum with the media, our master agreement with Doctors Nova Scotia. And I've talked about it in this House as well, that I believe that a new agreement will strengthen the healthcare system in Nova Scotia, will strengthen the issues that we've been having over the last year or so, whether it comes with the ICU issues in Amherst or Bridgewater, whether it comes with the ER closures that we're seeing in the wonderful community of Digby or the community of Tatamagouche. We need to have better ways to remunerate and incent and retain physicians in some of these areas. And I believe that this new agreement, as innovative and new as it is, it will have a tremendous effect on helping us in these rural areas. Our focus on the new agreement has been developed. It has been developed to develop a product that will fund service improvements for our citizens and support health system transformation process that we've already begun. Now, Mr. Chair, I can also say that this was a year process, a process that I know our department had an offer, and I know that Doctors Nova Scotia had an offer, but all the time, I think everybody sitting at that negotiating table had system improvement and system transformation on their minds, and I believe that the program and the agreement that we're presenting to doctors, I believe, starting tomorrow, will be one that they will sign on to, and one that they know will make a true change here in Nova Scotia. Again, this agreement has gone to Cabinet, has been ratified by Cabinet, and then has to go for ratification from the doctors across the system, which will be happening. I believe, hopefully, we'll have a positive agreement by about the 20th of May or 21st of May. Now, overall, the budget spends about 75% of its healthcare budget on human health resources. And we're excited that for the first time ever, this contract is helping to shape and support the changing role of physicians as we strive to provide more and better incentives for things like chronic disease management, more access for patients, and expansion of the electronic medical record system to doctor's office, as I did mention earlier in my speech. So with those short words, in closing, I would like to thank you for this opportunity to highlight some of the priorities of the 2008-2009 budget for the Department of Health, and I look forward to answering your questions. So, Mr. Chair, I will take my seat, and I look forward to, I believe, questions and comments from my critic from the NDP, the member for Sackville-Cobequid.
Thank you, Minister. The Chair will now recognize the Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman. And it's always a pleasure to stand before the committee to discuss, I think, what's one of the most important things here in our province, not only to government but to the people of Nova Scotia, and that's the healthcare system. The minister opened his remarks. What he has said and explained some of the things that are in the upcoming budget, painted I think more of a rosy picture of what the positives are here in Nova Scotia around the healthcare system and what's in the budget. But we know, Mr. Chairman, that there's a lot of issues in healthcare. Myself, as the NDP health critic, I know my colleagues, I'm sure the minister and his deputy minister and their office and all members receive numerous numbers of calls, concerns related to healthcare and healthcare issues here in this province. The minister mentioned a vision for healthcare here in Nova Scotia. They're going to have a vision for healthcare, which is great. I think that's a positive thing. But what the minister doesn't say is the fact that I know he hasn't been the Minister of Health since the mandate for this government started in 1999. But the government's been in power in this province and have been governing for close to 10 years, 9 years now, Mr. Chairman. 9 long years, as the member from Glace Base stated, Mr. Speaker, or Mr. Chairman. And 9 years ago, the Premier, or actually the opposition member, leader of the Conservative Party at the time, was Dr. John Ham, who campaigned at a time in the history here in the province that just seen numerous cuts to health care. And I think that was one of the pivotal points in that election in 1999 around the state of health care here in Nova Scotia. And at the time, the Premier Ham stated that with $46 million, if you were to elect the Conservatives, they would fix health care. Here we are 9 years later, Mr. Speaker, Mr. Chairman. We know that those numbers were way off and that the government hasn't fixed health care, the health care problems that we have here in this province. Mr. Chairman. And what I'll do over the next hour and over the next day or so with health estimates is try to bring some clarification, try to get some answers from government on why really they haven't looked or went down the path to try to improve health care delivery here in the province to ensure that Nova Scotians receive health care in a timely manner, Mr. Chairman. We know that we have long wait lists for surgeries. We know we have long wait lists for entry to or placement to long-term care facilities. We know there's long wait lists to see specialists and to long wait lists when a Nova Scotians find themselves in an emergency room if they're open, Mr. Chairman, because many rural emergency rooms, Mr. Chairman, close on a regular basis, sometimes on a daily basis. And that's a major concern with Nova Scotians. And part of the problem, I truly believe, and that's why I mentioned the Minister's statement around the vision for Nova Scotia, part of the problem is that we didn't have that vision. The government didn't have that vision back in 1999. They didn't have the plans in place. The Minister stated today that it's great to see they've put money towards a health human resource strategy in this budget. That's great, but that should have been done, I think, in the first few months of anybody taking government, Mr. Chairman, especially if you run a campaign on that you were going to fix health care here in the province of Nova Scotia, Mr. Chairman. We've seen some changes over the last year, some positive changes, some changes that really took place because of advocates in the community, because of MLAs in this House, things like Aveston, and I'll talk about that later on, Mr. Chairman. But we've seen changes, I think, that I know for myself as the NDP health critic and our caucus have seen are negative ones, are changes that we did not want the government to implement. And I'm mentioning the fact that the government has turned to the use of a private clinic for surgeries here in this province. And I mention that because the Minister mentioned the exit opinions that they're taking on individuals leaving that clinic are positive ones. No question they're positive. If I've been waiting 12, 18 months for a knee surgery, I wouldn't really care where it was done. I'd have a good experience and I'd be thankful that it was done. I understand that. But that's part of the problem, is the fact that we have such long wait lists that the public now will revert to anything. They don't care what happens. They need to get their surgery. They need to get on with the healing and getting the procedures they need. And honestly, when I heard that the Minister announced the contract for Scotia Surgery, I believe it was on the Friday before March break. Unfortunately, I wasn't here. I was away with the family at that time. But I heard that the Minister made that announcement and made the agreement with Scotia Surgery. What it really said to me, and I think to a lot of my colleagues, is that the government just gave up. They've realized that the initiatives they were trying to implement over the years just weren't working. And they've washed their hands of it, and now we're seeing private clinics here in Nova Scotia. I know the Minister would disagree. No question, we disagree on that. But that's our opinion. I think the fact that we've gone down that road is unfortunate, when I think there was obvious options that we had here in this province, if we only seen the plans I talked about earlier implemented by a government who was elected on the premise of fixing health care, Mr. Chairman. And I'll explore that throughout my questioning over the next little while. But really, that was, I think, a pivotal point here in Nova Scotia when the government agreed to do that. We knew the government were looking at that. The minister stated maybe a year ago or more that everything was on the table when it came to health care. We knew that. But it was an unfortunate day, I think, for myself to realize that that's the vision that the government is looking at. And we all know it wasn't recent. It was quite recent that I heard on the radio that the British Columbia government just canceled their agreement with their private surgery clinic because that surgery clinic was going to charge the province of British Columbia, I believe, somewhere around 20% more. And the government realized, whoa, we're over our heads here. We can't absorb that kind of cost increase in 1 year. So that's just one example around my concern of the private clinic. When we have options, as I said, we just witnessed, I think it was 2 weeks ago, Dr. Yap Bonger experiencing what might be able to happen at Stadacona, just down the street here, a facility which is there, is well staffed, well equipped, and I think ready to address some of the needs. And some of the questions I have around that is why did we use that before? Why didn't we attempt to use that before? And I'll give the minister a chance in a little while when I ask that direct question, line of questioning around that facility. I mean, that's a facility that was paid for by taxpayers, and that there's no shareholders who are going to profit from them doing surgery and providing health care here in the province. And basically that's my concern with private clinics is someone's going to make some money off this. And it's going to be at additional cost to the public system. So with those few intro remarks, I know the minister would love to jump up and just, talk about every one of those points. But as I said before, Mr. Chairman, there are concerns. We have concerns in long-term care, concerns around the transitional care, the closures of ERs, closures of ICUs. And recruitment and retention of rural physicians. But the most important thing we need to look at, we need to recognize, and we need to get some answers and hopefully ensure that the government recognizes the importance of it, is the key component to the whole healthcare system, and that's our healthcare providers. We've seen in the last year an attempt by the government to bring in legislation that really picked a fight with healthcare workers, and I'm talking about Bill 1, to take the right to strike away from healthcare workers. In my mind, Mr. Chairman, the last thing I want to see our government do is to increase the dissatisfaction of our healthcare workers when they go to work or when they perform their duties here in the province. Our key and our role here in Nova Scotia is to retain and recruit as many professionals as we can. We need them. And we're competing against places like Alberta who can pay them a lot more than we can. And I think the government and the minister says that that's not a part of why someone would come here, in questioning before. But I think it has a lot to do if you have someone who recognizes or knows someone in the healthcare field here in Nova Scotia saying, what's the atmosphere like? Well, we're still battling this thing with the government, and some of the terminology I heard is that they're using that to hold it over their heads over the next little while, because we know the government hasn't brought that to a vote, because we know that we would not support that, and the Liberal caucus said they wouldn't support that. So over the last year, we've seen some changes, some positive, as I said, but some I think have had a negative effect on the healthcare system and our healthcare providers. And as I said, those individuals are the most important individuals. So with that, I don't want the minister to respond to everything I just said. That was my opening comment. I will ask questions on a lot of those topics over the next couple of hours, today and then tomorrow. But we all know our workforce is getting older, and the need to recruit and retain healthcare providers is so important. It's the key to ensuring that we have a good system and a delivery of a good system. So here in Nova Scotia, we have the lowest percentage of RNs in Canada under the age of 35. That's an astonishing number. We have the lowest percentage of across the country of RNs under the age of 35. And we got that figure, and I hope the minister has some documentation on that, which I see him going through. But we got that information from the Canadian Institute of Health Information report for 2007. So really, what my question is to the minister is that we can talk about the actual percentage, but we are the lowest in the country. Why is Nova Scotia at that bottom? Why are we seeing less and less younger people working in our healthcare fields, either from trying to recruit them or retain the individuals who are being trained in our province now?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. Mr. Chair, I couldn't go without maybe answering a few of the overarching comments that the member brought forward. And Mr. Chair, one of the biggest one that he underlined was that the minister was very rosy and very positive about the healthcare system in Nova Scotia, and I am. Mr. Chair, to use a comment that I made yesterday is that I'm very bullish about the future for healthcare here in Nova Scotia. I'm very, very positive about it because I have to be. Because if we go and talk about all the negatives, and Mr. Chair, I'm not saying that there are negative things going on within our healthcare system. There are things that can be worked on and can be fixed. But if we are to do a good job of recruiting, a good job of retaining our healthcare workers, we have to be very positive about our system. And I hope that everyone within that system is as positive about it as I am. Now, Mr. Chair, even positive, the leader of the NDP is very positive about it. I remember him making a comment saying that we have the best healthcare system in Canada. I think it was Canada. I think he might even said North America. And I agree with that, because we do. Because we do have the best workers, we have the best staffing, we have great people, because they believe in the same thing that I believe in. One of the very fundamental issues when it comes to healthcare in this province, which is the patient is first. It's about the patient. It's not about buildings. It's not about programs. It's not about MRIs. It's about people. And we need to keep that person and that patient the first thing that we think about when we talk about any of these issues. And that's why I'm going to continue to stay positive about healthcare in this province. Mr. Chair, also, the member opposite talked about Scotia surgery, so I'm going to look forward to his questioning on that one, where we maybe can talk a little bit about cost comparisons with Scotia surgery versus other options within our system, and I will have some information on that one. But he did talk about recruitment and retention of nurses, and I do agree that we do have an aging population of nurses in this province. I did talk about one opportunity that we're making available to late career nurses, the ones that have a lot to offer to this province, but maybe just can't work on a floor anymore, or feel that they should be doing something different. And Mr. Chair, I believe the nurse call line will be one option for some of those nurses. So not only finding new nurses, but also retaining some of that expertise that we really need to maintain and continue the system that we have in Nova Scotia. To give you some numbers on nursing and through our nursing strategy, and Mr. Chair, our nursing strategy is still utilized as a model and one of the better ways to retain and keep and train nurses in all of Canada. And I can say that in nursing retention and strategies, recruitment and strategies in Nova Scotia, we're going to be spending $9.7 million on that very issue in this province. So I'm hoping we will reap the benefits of that in the near future. Mr. Chair, yesterday from a question that I received on nursing again, as I said, at the end of academic year 2008, 296 registered nurses will graduate. At the end of 2008 as well, there'll be 153 LPNs graduating. From what we can understand at this point, from Career Beacon, which is of course the listing agent for jobs in the province and for our district health authorities, there are, I think, 103 postings, which there could be multiple postings within that, but we believe it to be probably somewhere near 100 and 150 open positions. I do have some other numbers, and I forget where I put them. They could be on my BlackBerry, but it really talks to how many nurses we have employed in this province, how many are on full-time contracts, how many of them are on either part-time or casual. And we do have probably a large number of full-time nurses than any other province in the country on full-time nursing percentage. So we'll continue to offer, real jobs. I think some of the problems we've had in the past is district health authorities, regions, hospitals were hiring people on casual contracts. And, if you're a young individual with a student loan, whatever it may be, and Mr. Chair, I could probably talk a lot about what Department of Education is doing, what the Minister of Education is doing when it comes to debt relief and when it comes to students, but I'll stay away from that one for today. But even through our department, we know that we retain over 80% of the new trainees in the province. So it doesn't take long to do the math of that 296 plus 153, that 80% of those will stay here in Nova Scotia and offer services to our patients in Nova Scotia. So I think that our nursing strategy is working, and hopefully that number will continue to drop, that percentage of older nurses versus younger nurses. So it is something we'll continue to work on. And I believe, again, our nursing strategy, which is made up of staff, Department of Health, of course, Nurses Union, the College of Nurses, etc., are all working together to find the solutions to keep more nurses and train more nurses in this province.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman, and that's why I wanted to start off with the fact, with that figure I mentioned, where we have the lowest percentage of healthcare or nurses under the age of 35, because it reflects truly what the demographics are of our healthcare system, especially with nursing. And as the $1 million report of the Corpus Sanchez report stated, we're going to have close to 1,300. I think it's 1,290 something. Nurses eligible to retire in the next 2 years. So it's good to see in this budget that the government has looked at putting more funds towards increasing the number of new seats for nursing here in the province. So a quick question to the Minister. I believe it's the $851,000 figure. Is that the number that is targeted or is going to increase the number of seats available in the province? And if that is the number, or whatever the number is, how many new nursing seats will we see in the province this year or in the coming year?
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And the member opposite underlines a very important thing when it comes to our health system and the things that we did learn from the Corpus Sanchez report. What is the real impetus on transformation to begin with? Transformation in the system is really being pushed by three things. One being demand, as I spoke to in my opening remarks, of the aging population that we have and requiring more and more services. The changing medical technologies and treatments that people deserve to have, as well as our HHR issues, as well as the cost, the growing cost that I believe the member from the Liberal Party did mention in her remarks earlier today. So, to speak more specifically to your comment and question, the $851,000 increase does not speak to the new seats that we're adding. It speaks to the regular increase in operating the two programs, I believe, at St. FX and UCCB. And maybe if you ask another question, I'll have further details on as we do. Sorry, CBU. I wrote that down wrong. I have to apologize for the member for Glace Bay and all members from Cape Breton for calling it UCCB. That, of course, is something hard to get out of your head. But then again, CBU. The RN programs, the expansion of RN seats in the province, and I forget how many seats that is, but there's an expansion of $1.3 million for expanded seats in the province. LPNs, of course, to NSCC, there's an added $1.9 million to expand seats in the province. The other very important piece that I think it is when it comes to training nurses in this province is that the number that we have, and I forget the total number of training seats that we have in this province, but we have as many training seats today as we had prior to the 90s when the two-year programs were brought in place. So we are finally caught up, I think, on training seats for nurses. Now, of course, the work will be through our strategy in hiring and retaining these individuals.
Honourable Member for Sackville-Cobequid.
So I thank the Minister for giving me those figures for the RN and the LPN. So if you could, at a later date, get me the number of seats you project. Like I would assume you would calculate what that would be and how many new seats. And the reason I mention that, and the reason I'm looking at numbers, is because truly that's what we need. We need numbers. We need to get more healthcare providers trained, especially nurses, and we need to entice them and recruit them and ensure they stay in the province. And from our records, I believe the Dow campus has 135 nurses, and the Yarmouth facility takes another 20. So it's about 155 nurses being trained, and of course that's on a yearly basis, and then the turnover is every 4 years. And then of course we have the LPNs and that, and then the CCAs that are trained at community college. One of the reasons I'm concentrating on the nursing seat number is I think it's an important one, because that's where we seem, every time I stand up and question the minister on, is we don't have enough seats. I asked the minister today about OR nurses. And of course we need a nurse to be trained and then later on get specialized training, which I think the telehealth that the minister mentioned would be appropriate for that. But we really need those individuals, those young people, because we have such an aging workforce, young people to enter the healthcare fields and the professions. And I believe from what we know at Dalhousie, for example, the nursing program last year had over 700 applicants for those 135 seats. 700. And I must say, I was always under the assumption over the last number of years that the healthcare field wasn't as appealing to new students, young students coming out of high school. I just assumed that. But then, and over the next few minutes, I'm going to cover quite a few disciplines within the healthcare field. I recognize that there is quite a few students who want to work in healthcare, that they want to be trained. And many of them, if 80% of them anyways right now, would stay here. So my question is, why are we allowing those young adults to, I think, be lost in the healthcare field? Because you know what's going to happen if you apply to nursing and you're one of 700 to get 135 positions. They're going to choose to do something else, get in some other field, and who knows? We've lost them forever. So with such high numbers like that, I think, why are we not putting more of an emphasis, and that's why I asked for the number of seats, on increasing the capacity for training, especially around nursing like this one?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, I'm just trying to crunch some numbers what my total nursing seats are in the province. But just to speak to what this year's budget does bring us, total LPNs will be increasing the number by 223 LPNs. So that's 6 additional 30-student classes. It's 180 plus some other programs, expansion, so 223 new seats for LPNs. Total RNs, and this will max out the capacity, I believe, in the current schools. So whether it be CBU, whether it be St. FX, whether it be Dalhousie University, We're expanding that by 70 seats. And what I'll do is I'll try to have the number of total seats across the province for nurses. And that doesn't speak as well as I did in my opening remarks, is the 1,000 CCAs that we'll be training this year. And also, this is a great opportunity to thank NSCC for the work that they're doing in health human resources. They've done a phenomenal job in meeting our requests, and I'm sure when we started talking to them on expansion of these programs, that they looked at us with like we had holes in our heads, that we needed that much training to go on in a very short period of time, but hats off to them that they've been able to meet our demand. The other program that I'm very, very happy about is the MLT program, the Medical Laboratory Technologies program over at the new campus in Dartmouth. And you know, for the first year, this is the first year that we've had a medical laboratory technology program on Nova Scotian soil in a very, very long time. And I think there's 25 students, I believe, going through there per year. So, you know, over the next number of years, we're going to be able to train, 25 per year as they'll run through the system. Again, one of the issues that was brought forward in the Corpus Sanchez report was by 2015, so, you know, the clock's ticking really quick, that about half of our medical laboratory technicians around the province will be ready to retire. So anyway, it's we are starting to see a true expansion in maximizing the opportunity that we have in this province, starting some new programs. Next year, we're starting the medical radiological assistant program to help out in hospitals with that kind of technology. So more and more, we're training right here at home, and I think the opportunity to train right here at home is to train Nova Scotia students, and incent them and hope that they go back to their home communities to work, live, and raise a family.
Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman. One of the things that government need to recognize is that they need to have benchmarks set up in order to know what the recruitment and retention numbers will be, or what they're going to use to recruit new healthcare workers in the coming years. The province, they need to know how many they're going to go after. I think you should know how many you go after. So the question is there a benchmark of how many healthcare providers you're going after, like RNs, lab technologists, X-ray technologists, even social workers, over the next year, 2 years, maybe even 7 years? I wonder if the minister could comment on their benchmarks for those healthcare providers.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, maybe we just use a different word, but we're going to call it a target, whether that be a benchmark or a target. I really don't think it matters. But our target is approximately, and this is just on RN, LPN, and CCA, is 2,298 individuals. So there's an opportunity for Nova Scotians, our kids in our communities, our loved ones, our families, our friends, to have an opportunity to work in Nova Scotia in the healthcare field. 2,298 individuals. So that's our target when it comes to those specific.
Honourable Member for Sackville-Cobequid.
And with that target, how does that compare? And I don't have the figure, that's why I asked. How does that compare with what the Corpus Sanchez report indicated? Do you know that, the target they had set in that report?
The Honourable Minister of Health.
Thank you very much. From what we know at this point, and we're continuing to have a new and invigorated HHR strategy available in June. But with the information that we now have through Corpus Sanchez and the work that we have been already doing in the communities through our healthcare system, we believe we're sort of pretty much all in the same ballpark. That 2,000 number or 2,200 number, 2,300 number is one that will address the system gaps that we have today. The
Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair. And we'll definitely be keeping an eye on that. And that was one of my questions later on: is when will that new Health Human Resource report be released? And the minister said June, and hopefully that'll be publicly released so that Nova Scotians can see that. And I'll hold you to that date, not July, but you said June. And that goes back to one of the criticisms I had at the start. I mean, here you are, you've been health minister for maybe 2 years, over 2 years, in government. Your government's been in government for 9 years, and we're going to see it in June of 2008, 9 years later. So I hope that it has some positive information in that. So that brings me to I believe it was in the paper today, and I don't know if the minister's aware of this. It was the Truro Daily News, around the frustrations of a grade 12 student who was interviewed, an honor student who wants to be educated as a diagnostic medical ultrasound individual at the program at Dalhousie. And she's frustrated, not because she doesn't have an opportunity to seek the training, but she's frustrated because she did apply for that program and was told that she was on a waiting list. So we've talked about waiting lists for surgeries, waiting lists for specialists, waiting lists for long-term care. And now we're starting to hear, like I said, about the 700 nurses who applied for a nursing program, or students applied for the nursing program. We have a grade 12 student who wants to work it, and she's on a wait list. But what's more frustrating for this young individual, this person who we should be, and this is more rural community, we should be ensuring that this person can be educated here in Nova Scotia and stay in Nova Scotia. What was most frustrating for this individual was that she just recently heard Peter McKinnon, CEO of Colchester East Hants Health Authority, speak around the fact that they're creating a bursary program aimed at trying to entice local high school students to fill hard-fill positions, or positions that they could not fill in the hospital, like diagnostic medical ultrasound. So this individual is going in the right approach. So we need this individual. She was told she was 90 on a wait list for that program, which I believe only has 5 seats. So what do you say to a young girl like this who wants to be trained, wants to be educated here in Nova Scotia, and wants to return to her roots, her community? What are we going to do? I think we're going to lose this individual. Why is it so hard for this individual? If we need them, then what government needs to do is increase the money to support the increase in seats to train these individuals. There should not be a wait list for medical ultrasound students. There should not be a wait list for nursing students, for doctors. My Lord, we should be going after these people. We could eliminate recruitment. What we need is just work on retention, keeping those individuals in our province. And we do have a good success rate with 80%, and I think could be better. Why is this situation happen? Why is this young person from Truro area, from Colchester Hants, East Hants area, unable to do the training she wants and work in the field that is needed here in the province?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, this is one of my frustrations on a regular basis. Doesn't matter the profession within the system. It does happen quite often, whether it be trying to be a physician, whether it meant trying to be one of those other pieces like the ultrasound technician or radiological technologist. There are very small programs within Dalhousie University for the most part to offer these programs. And what we really need to have is a better appreciation, I think a better partnership with Dalhousie University in health human resource. I mean, they really, I believe, and we've had discussions around this, really ramp up their health profession programming and really decide whether they are the right service provider to be training these individuals, or should they be focusing a little more on the nursing and the doctorate program. I believe there's an opportunity again through our community colleges to be training some of these individuals. And I think we need to really, NSCC has really stepped up when it comes to the radiology, the laboratory technologists. They've really stepped up on CCA. They've really stepped up on LPN. And I think there's some other professions in there they would really like to take over from Dalhousie University. And I'm probably sure that Dalhousie University might even want to let those programs go into a more public opportunity. And I think the seats that they might have available would be better. I've talked about it here in the House. I've talked about it on many speeches around this province, that I believe it's much easier to retain a profession that we've taken and trained from a local community and got them to go back into that community than we have of trying to attract somebody from Hong Kong, or we have to try to get somebody from Yukon, or somebody that's been trained in Toronto. It's difficult to get somebody to not go into their milieu, to get into their comfort zone, unless the person has been there. Dal actually, and I do speak negatively about Dal sometimes, but I can also speak positively about them, is that they're supporting the opportunity for educational laddering now, which is absolutely phenomenal, where an individual today can go and maybe start off in CCA. NSCC will allow them to continue in LPN. Dalhousie will then allow them to go from LPN to RN, et cetera, to be able to move and react to the needs within our system. So I think there's been a lot of work done in that respect. But at the same time, we do hear quite often of these individuals who want to go on to the health profession and really can't get there. I don't know the details around how many seats are available for ultrasound technologists or how they are trained, but I could look into that information as we come along.
Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman. From our information, that's 5 seats for medical ultrasound, 13 seats for radiology technology, and 8 seats for nuclear med. Radiology has 37 people waiting on a list to get into the course. Nuclear med has 18, and as I said, our stats say there's 40 people waiting for the ultrasound, but the young lady who was quoted in the paper said she was told she was somewhere around 90. And with all due respect to the minister, that wasn't good enough. Why are we not doing it? The number one thing people say to me is, why don't we just train more doctors? It's a good question. I understand that the Dalhousie University is separate from government, but the funding is there. We need to do something. If our ERs are closing, our ICUs are closing, our labs are shutting down because we don't have people to work there, the government's responsible. We need to address those healthcare needs, so we need to invest more money into it. We need to say, listen, the priorities of government right now is to ensure that we have enough healthcare workers to meet the needs. And I think we need to see more of a move towards addressing that. And I'm frustrated when I see and hear young people say they want to do that, but they can't do that. And it comes down to, as I said, recruitment and retention of healthcare workers, and job satisfaction, really. That, I think, plays such an important role with the retention, of course, of healthcare providers. Because if you're going to be enticed to go somewhere else and you're not happy with the job you're now, you're going to go. And sometimes you go for less money, but often they're being enticed with a lot more money. So that's why it's so important that we recognize job satisfaction and the working environment that our healthcare workers are in. So now I'd like to turn towards the overtime that we see so many of our healthcare workers put in over the course of a year, Mr. Chairman. Unbelievable how much our healthcare workers work overtime to meet the needs of the people of this province. Mr. Chairman, you were there, I was there. We worked a lot of hours to ensure Nova Scotians were safe when it comes to medical care, ground ambulance. We know our colleagues, nurses, doctors, technologists, every one of them, the majority of them, if not all of them, work some form of overtime. And what was the most discouraging part of when I first learned this was when my son was born. He was in the special care nursery. And we had this wonderful, wonderful nurse. And I agree with the minister about the care we get here in Nova Scotia is unbelievable. We had a wonderful nurse take care of our son. And she was there all week. And we talked with her. My wife sat with her all day during her shift. And she was looking so forward to the weekend. So on Saturday when I came in, I noticed the nurse was still there. And I asked her what happened. And you know what she told me, Mr. Chairman? She said she answered her phone. And I said, well, what do you mean you answered your phone? Well, we have mandatory overtime. I answered my phone. I had to come in for the shift. So that's a prime example of an individual, a healthcare worker, who is in a job that is stressful. Any nursery, special care nursery, intensive care for children is such a high level of stress area, and the importance to have that individual have such a good job satisfaction is important for any outcome for a sick child. So what does the province pay in overtime for nurses? Do you have that figure, the overtime cost for nurses? I see the guy who does the books is shaking his head no, so maybe I should sit down. He might want to reply on that, but do you calculate or can you calculate, can you get myself at a later date what the province pays in overtime to nurses?
The Honourable Minister of Health.
Yeah, we don't hold those numbers centrally, but what I can do is maybe get some numbers from the district health authorities who are responsible for the day-to-day hours of the nursing staff, and get that back to you as soon as I can. So we'll survey survey the district health authorities. But Mr. Chair, what I do want to talk about a little bit here is the overtime issue is very concerning, and one that you know, if you're asking too much of a person, eventually that person will end up burning out. And that's the last thing that we need in this province, is to have people in our system who are burnt out. Mr. Chair, which is why one of the recommendations within the corporate census report was to design a model of care. And model of care really means allowing different practitioners to work to their full scope of practice. You know, we do have a number of people, whether they be nurses or clerks or what have you, not doing the things that they're trained to do, not working to the full scope of their training of being clinicians, of being what have you. We're finding that nurses are spending far too much time filling out paperwork. You know, spending the last hour or 2 hours of their shifts simply filling out paperwork, which really a ward clerk could be doing. We could be getting way more service out of a nurse for the 2 hours that we could spend on having a ward clerk in place. So the model of care will truly look at the roles and responsibilities of the staff within units and look at the most appropriate way to use them. And I think, personally, through that, we will save a lot of money in overtime. That's where it's at, and I know exactly where the member opposite is coming from, because I hear it too often. I too have an aunt who is a nurse who happens to work in a special nursery, yeah, she leaves the phone off. You know, that's a hard statement, and it's hard for her to say, you know, listen, I need today off, or I'm not going to be any good tomorrow. And I know there's a lot of other staff that are doing that very thing, and you know, I can't blame them at all. The work that they do is difficult. There's many of us in this room who could not do that kind of work, even though we do seem to work ourselves to the limit sometimes. But at the same time, it's very traumatic, it's very difficult, mentally very, very challenging. And I think that we do need to do much better work in harnessing that overtime and letting nurses be nurses, and let cleaners be cleaners, and let, you know, the ward clerks be ward clerks, and even to the point of letting RNs be RNs, let LPNs be LPNs. So, you know, there's a lot of overlap that's happening today on those wards and on those floors that is causing this overtime issue. And I believe through this model of care initiative that we've initiated will make that difference.
Thank you. The honourable member from Sackville-Cobequid.
Thank you, Mr. Chair. It's kind of unbelievable, a little bit shocking to know that you don't have that figure on your hand with you in your books. Something you could give me. I mean, it's an over $3 billion investment in healthcare, and you don't have the figure of overtime. I know it's in the millions. It might even be in the tens of millions of dollars. The figures I have, Mr. Chairman, just from the VG and Halifax Infirmary nurses, and this is just over a year, it'd be 17 months. And that 17 months figure that I asked for and was told was $5.5 million for over 17 months. Now that's just a quarter, if not even a quarter, of the healthcare workers. I think that might just include maybe 6,000 nurses. There's some 25,000 or more throughout the province. So we're talking millions and millions and millions of dollars. And some people might say, that's great, I wish I could grab a hold of that, put it in my pocket. But I can tell you, money isn't everything it adds up to when it comes to the hours put in by healthcare workers. They don't work regular shifts like most people do. They don't work 8-hour shifts. It's not like they're going in for 8 hours. They work 12-hour shifts, sometimes longer, because of the overlap, because maybe they have a critically ill patient that they cannot leave without stabilizing them. Or it's like paramedics can't say, no, my shift's over, not responding to this car accident. You know, they're made, it's mandatory, they're forced into it, and they love doing it, they don't mind doing it. And as I said, the money is not important to them. What I think would be more important to them, well, it might be a little bit important to them, everybody likes making a little more money, but what's most important is that job satisfaction and that ability to just exhale. The minister mentioned this, you know, he knows personally the work that's entailed in healthcare, you know, dealing with the death and dying individuals in this province. I've been there, Mr. Chairman. I've seen children dying. I've seen adults dying. It's a stressful situation, and I'm always curious on where back in history it was ever written that healthcare workers who work in probably the most stressful environment there is will work 12-hour shifts compared to someone who works in an office working 8-hour shifts. Not that office work isn't stressful. I know by switching professions that sitting behind a desk sometimes for 8 hours can be stressful, but I still don't understand why we put that pressure on our nurses, our paramedics, our healthcare providers, and let alone the doctors and the interns and the residents who work days on end. So why I turned it towards the stress and that not only just the overtime is the fact that recently we know, and I think the minister knows and deputy minister might know, around problems around the OR and some of the staff in the OR and the requirements on them to perform their job many times past the end of their shift, and then being required to show up to work within sometimes 6 hours. And I know that recently in the OR in Halifax here, RNs, perfusionists, OR techs, LPNs, anesthesia assistants work frequently past 1 a.m. Because of emergencies and other things beyond their control, and are required to return to work within 6 hours. Right there, that's a prime example of how I can see within, if that situation isn't addressed, would turn into a highly stressful job. Satisfaction rate for those healthcare workers will go down, and what has happened is they're going to refuse to work, and it has happened because of their fear of doing something wrong. And I know that a couple individuals in the ORs here in Halifax has refused to show up to work the following day because of them safety concerns. They're worried about their drive home, the safety of themselves, but most importantly, we always hear from healthcare workers, they're worried about the patients that they may need to work on tomorrow, the next day. You know, I've worked a 24-hour, 48-hour shift as a paramedic, and I can tell you, when you get a call on the 46th hour, the service that that individual gets is not the same as in the first 2 to 3 hours of a 48-hour shift. Now that's an example that what happened in the past. So I'd like to ask the minister, what is he doing to ensure the people in the OR are safe, but most importantly, the people they're looking after because of that short window where they're required to return to work. And I know that's under policy and procedure of district health, but you're the Minister of Health. You need to step in and say, we can't let this happen. So can you give me any information on maybe that what's happening with that and what you could do to fix that issue?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, you know, there's a lot of issues, of course, also in the collective agreement that I could probably help provide to the member when it comes to the management of those shifts and things. You know, the 12-hour shift is also something that, you know, I have a hard time understanding. I know in the past, other governments have tried to change that 12-hour shift to maybe 8-hour shifts and things like that, and nobody wanted it. So it's kind of a sort of a catch-22 that's the model of care that nurses and other health professionals are comfortable in working in, and it's a very difficult thing to change. The member opposite also talked about the availability of the numbers. The numbers available to know how much overtime is being spent in our nursing staff, you know, in the overtime, and we do have a challenge in knowing what's exactly happening on a day-to-day basis on the finances of our district health authorities. And I'm very happy to say that in this year's budget, there's about $4.4 million in operating costs on our new HAPS system, or the Youth Health, anyway, the SAP system for healthcare. And this year's also is to expand this into all the districts, of course, is an investment of $10.9 million, so that we here in Halifax at the department can know and react to issues that are happening on the ground. So we can look at a district health authority and say, you know, why is there so much overtime? You know, what is your concerns there? Is it about hiring? Is it about sicknesses? Is it about something else? And I think we can be more reactive to that. So I'm very happy to have that kind of dollars available there. The other thing that I talked about when I had the question today in question period revolved around training for OR nurses. You know, we really need to have more OR nurses in this province. And I can say through our $500,000 investment in the skills lab over at the VG site, or the old nurses' residence, if anyone remembers where that is. I'm sure a lot of people visited nurses in their time at the nurses' residence. But anyway, in the basement of that is a beautiful, brand new skills lab. And if any one of you are interested in dropping in to see what kind of equipment and training will be able to be had there, I invite you. Just ask me anytime. We'll pop down and we'll use a couple endoscopy machines, and we'll cut some ribbons and do some stuff. Anytime that you want to drop by. But no, you can use it on. I don't think you can use it on me. I think the member opposite's in jest. Doesn't want to use anything endoscopically on me. Just having a couple holes and some sticks in me, it doesn't sound appealing if I don't need to have it. But Mr. Chair, in all jest aside, it's a phenomenal facility. One, again, that was the brainchild of the District Health Authority, of Dow Surgery, of Yap Bonnier and his team, to have the ongoing skills available to physicians and nurses. And I can say that when I got to visit it just the other day, there was a course of 9 nurses, OR nurses, that can go and train and get the simulation of doing endoscopy, of doing, I believe there's a whole bunch of different simulators there, but they can do anything from eye surgeries to different endoscopic surgeries to different kinds of scopes that are available there, and get their skills to the best it possibly can be, but also train those nurses who have the interest in working in the OR, and of course increasing our complement of individuals there. And Mr. Chair, the other thing that I do want to quickly mention is that all through Capital Health's keeping the promise, Dow Surgery's keeping the promise, is taking those ORs and utilizing them to their fullest. And I can say that today, I forget how many ORs it is, it's 32, 28, anyway, somewhere close to 30 ORs are now being used on a regular basis. When I can say that less than a year ago, less than half of those ORs were being used because lack of anesthesiology. So we've stepped up, and Capital Health has stepped up to make a difference in wait times and having the surgeries available for them. So with those quick comments, I'll take my place.
Thank you. The honourable member has approximately 3 minutes left. The honourable member from Sackville-Cobequid.
Thank you, Mr. Chairman. And the question I was asking the minister, and I don't know if he really answered it, but he went down a road. I know he was trying to use some of the time up here, and I'm quite aware of the area he's talking about. Actually, in the Bethune building was in the basement, or in where the skills clinic is, was actually where I started my paramedic course at, and then we moved up to actually the floor where the nursing residence used to be. And I think you know, we all understand changes in the healthcare system, but that was another change that I think had a negative effect on the healthcare system when we did transfer to a degree program, when we had that facility, which was a hospital-based facility with a 2-year diploma program for a registered nurse. And you know, that's why it's so important we recognize what we had there, because you know, those hospital-based training experiences are probably the best way to ensure that we have competent healthcare providers, that we have healthcare providers that are exposed at an early stage in their education to what the real world's going to be like. Far too often we hear from those healthcare providers who are in an extended program that it wasn't until the second, maybe even third year before I actually put my hands on a patient and were exposed to what we would be required when we graduated. And I think that was a short-sightedness on behalf of everybody involved, government, and those who were making the decisions at the time. I know for myself that experience, having a hospital-based setting for my education, was a positive effect on my career as a medic, and I think had a positive effect on my skills and what I could bring to the patients that I treated once I graduated. But it still doesn't get around the fact that, you know, once we have people educated, once we have them in the workforce, that then all of a sudden we've attracted an individual, and then we place them into environments like I mentioned earlier in the OR, where they're stressful, they're working long hours, and I think with those comments, Mr. Speaker, I'll pick up from there in my next hour after the critic for the Liberal Party.
Thank you. The chair now recognizes the honourable member from Glace Bay.
Thank you, Mr. Chair. Well, we find ourselves at this time of the year that we all so dearly love in budget estimates, and I'll say this to begin with: there is nobody, in all fairness to the minister, there is no one who has all the answers to healthcare problems in this province, me included, and members of the opposition. Former ministers haven't had the answer, as a matter of fact, Mr. Speaker. Mr. Chair. So we know that the problems are so complex that the answers are probably going to be just as complex. We know we can use sessions like this to try and drill down a little deeper. Unfortunately, it almost sometimes seems like a bottomless pit that we're drilling into in terms of health care. And I know that, in all honesty, I've said this before, and I'll say it again to start out my comments during budget estimates on the subject of health. And I know that your staff, Mr. Minister, that are associated, the Deputy Minister and her staff as well, have all the good intentions in the world. Unfortunately, they can't have all the money that goes with it or else they could solve the problem. They do have a good percentage of that money that goes with it in Nova Scotia, and we know that that percentage, unfortunately, has not gone down, and we know all of the problems that are associated with it. Everything from ER closures to shortages of doctors and shortages of nurses, shortages of other healthcare professionals, technicians and technologists that are going to come up over the next several years, and will indeed, if not put us where we are now. I think most of us will admit we are in somewhat of a crisis regarding healthcare in this country and in this province, and that we could be headed for somewhat of a bigger crisis. And I think right now it's incumbent upon us all that if we don't tackle this problem, we know that we're going to have something on our hands in the not too distant future that we just won't be able to handle. So, you know, in a session like this, it's important, number one, and I'm not lecturing Mr. Minister, it's important for you to have some of the answers. It's important for you to certainly have the willingness to provide those answers to questions that the opposition members are going to ask, because they are important to us and they are important to you and your staff in finally determining and coming about to somewhat of a conclusion as to where we're going to go with this and some of the solutions that may be out there. As I said, not all of us have all of the solutions. Together, perhaps we can come up with some. Let me state that unfortunately, saying, Mr. Minister, that unfortunately, as we can continue to talk about such things as ER closures and doctor shortages and nursing shortages, we don't have to go too far into the past to find out that those issues are with us here today. We talk, and you've been talking about solutions to the issues surrounding nursing vacancies. We look no further than we're aware of the fact that Fisherman's Memorial Hospital, its ER was closed due to a lack of nurses today. So we know that that's not the first time that has happened at that hospital. We know it's been closed due to a lack of nurses before, and sadly we know that's likely not going to be the last time that happens as well. And during the member for Sackville-Cobequid's questions to you, of interest to me as well, and I think of interest to all of us, there was some discussion about the numbers involved in nursing and so on, and the number of initiatives that there are. I'd like to know, as my first question, if the minister could indicate what initiatives there are under nursing initiatives in the supplementary details on page 14.7. On page 14.7, I'd like to know if the minister could indicate what initiatives under those initiatives will address the issue of ER closures that are due to a lack of nurses.
The Honourable the Minister of Health.
It's quite unusual for us to close the ERs in terms of the black nurses.
Thank you very much, Mr. Chair. And Mr. Chair, you know, from time to time, we have had closures of ERs due to the lack of nursing staff, and it's one thing that of course concerns us on a regular basis. And we've said and will continue to say that you know, we will not be closing ERs in the province, and you know, we'll be trying our best to find the full complements of individuals there. Mr. Chair, more specifically to the member's question, just on recruitment, because I think it's sort of the general issue of having nurses in our system. And by having new nurses in our system, then the ones who are more seasoned can move on and get that extra training so that they can move into places like ERs or ORs or what have you. That does require more training. So just to give you a listing, basically from that item, this year in advertising and promotion, which includes TV, radio, theaters, job fairs, we'll be spending $500,000. The RN recruitment initiative, and we'll continue to work on the strategy for that. $250,000 has been allocated. The RN third-year cooperative experience, which 40 students are experiencing, I think about $6,000 a pop on that, so that's $240,000. facility-based recruitment and retention initiatives fund. So each hospital has access to some dollars to recruit, which is what, $239,000. Facilities-based placement premium, which are of course incentives for premiums to get into some more of our remote areas or places that are more challenges, which is I believe 84,370. As well as upgrade for food handlers and medication management modules, which sometimes they don't have when they have their new training, which is somewhere close to $80,000. And we'll continue to work through the strategy, through the college on assessors for prior learning assessments of $200,000 and a coordinator so that this transfer of credit programs and things like that, about $150,000. So just in recruitment today, in this year's budget, we're looking at 1.7 or $1,744,170 dollars. These are additional dollars these years in this year. These are additional dollars on recruitment. These are already there are already other dollars within the overall $5 million nurses strategy. So we feel that we're doing an awful lot to incent and retain nurses in this province.
Thank you. The honourable member from Glace Bay.
I'll ask the minister for a little clarification, if he would. There's a lot of numbers there to digest, but what I was looking for is directly what is going to go towards the issue of ER closures because of a lack of nurses. You and I both agree there's a problem there. We know there is a problem there. We know the problem's been around for a while, and it may be around for a little while longer. But specifically, how much of what you're talking about is going to go directly towards the problem of the lack of nurses within emergency rooms?
Thank you. The Honourable Minister of Health.
Thank you very much. And more specifically, there's really two axes in which we're working on this one. And one that I speak to when it comes to recruitment and retention of nurses is to have more nurses in the system. I mean, more nurses in the system will allow advancement of the nurses that are there today to go and work in places like emergency rooms. So I think that will help the opening and closure, help the opening of those closed ERs. At the same time, as I responded to the NDP critic, the model of care initiative, I believe, will really redesign the way nurses are utilized within the system, that we can more efficiently have them in our system. So I think those two axes will stop, or at least slow, the closures of ERs in this province.
Thank you. The Honourable Member for Glace Bay.
Thank you, Mr. Chair. In discussion as well with my colleague from Sackville-Cobequid, the minister mentioned that there was a figure of $851,000 that would be involved under the nursing initiatives that would go towards the number of nurse training seats. Is that the number? Can the minister confirm that figure of $851,000?
The Honourable Minister of Health.
Thank you very much. No, the $851,000 is simply the increase in cost to offer the existing seats today. So the increase in wages and salaries and benefits and those kinds of things. And there was some, and I forget what the dollars were attached to the new seats that we're adding to St. FX and Dalhousie and Cape Breton. I believe we're adding $1.3 million for RN training, and we're adding $1.9 million for LPN training.
Thank you. The Honourable Member for Glace Bay.
Thank you, Mr. Chair. The minister, please tell us then how many nursing seats is that going to create, and where they'll be created?
Thank you. The Honourable Minister of Health.
Oh, okay. I don't have it per site. What I do is have the general numbers for the expansion. LPNs was 223 new seats, so new training seats, and 70 new RN training seats. What I can do is I can endeavor to have those numbers hopefully tomorrow on how many seats per site, so have a better idea of how many are going to be at Cape Breton University, how many at St. FX, how many at Dalhousie.
Thank you. The Honourable the Member for Glace Bay.
Thank you, Mr. Chair. Well, perhaps, I don't know if the minister would have this answer now or not, and if not, perhaps he could provide that with the other details he's talking about. But along with where those seats would be located, when those additional when those additional nurses would graduate, when is it that they're going to graduate? And the reason I ask that is because the Nova Scotia Government Employees Union has a prediction that by the year 2010, we'll be short by about 1,260 nurses in the system, which is it's scary. But the Corpus Sanchez report makes a similar prediction as well. So perhaps the minister could tell me then if he does know now, and if not, then will he get those figures for me, please?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, I don't have necessarily those specific how many we're going to have trained within that certain amount of time, but just out of the 223